As you've heard earlier, oral cancer is one of the most common malignancies worldwide and has a poor 5-year survival rate, which unfortunately hasn't changed in the last few decades. With recent advances in screening for this disease, there's been a tremendous increase in the number of early-stage oral lesions that can now be detected. However, only a small portion of these lesions actually progress into the more severe advanced stages of oral cancer. And so, now more than ever, molecular signatures are needed to help clinicians to isolate these lesions from the bulk of all the non-threatening ones and then assign proper treatment strategies. To achieve this, we need to gain a better understanding of oral cancer at the molecular level. One of the areas on which I'm very interested in investigating is identifying the roles of small regulatory molecules called microRNAs in oral cancer development. These molecules control the expression of various genes that either inhibit or promote oral cancer progression. So, when certain microRNAs are present in the cell at abnormal levels, their target genes are affected as well, and this can potentially lead to oral cancer. Through my research, I'm specifically interested in investigating which microRNAs are deregulated in the earlier stages of oral cancer, and then select the ones that can be used for clinical purposes. From each of the patients in my study, both normal and diseased tissues collected at the same time from a single region in the oral cavity. I next use a molecular biology technique called quantitative real-time PCR to measure the levels of microRNAs in these patient samples. So far, I have examined 9 tissue samples from 3 patient cases for the expression of 742 human microRNAs. And across this pool of samples, I've detected microRNAs whose levels were consistently altered in diseased tissue compared to normal tissue. Of course, to confirm these results, I'm currently adding additional patient samples, and after narrowing down the list of potential candidate microRNAs, I will correlate these findings with patient characteristics such as survival rates. And this type of analysis will show whether there are any potential associations between these clinical features. Ultimately, through this study, I will discover molecular markers that can help predict the aggressiveness of early-stage oral lesions, and then indicate when urgent intervention is required. In addition, these molecules may function as future therapeutic targets, and hopefully help reduce the incidence of oral cancer-related deaths. Thank you.